Hello everyone, my name is Alicia Sweeney, and today we're going to take a look at whether or not core strengthening exercises or lower extremity exercises are more effective for increasing dynamic balance in our elderly physical therapy patient. Before we begin, did you know that more than 1/3 of older adults fall each year? Falls are the leading cause of injury-related deaths, the most common cause of non-fatal injuries, and the most common reason for hospital admission among the elderly population. Every hour, one death and 183 emergency room visits occur among older adults due to falls. Look at our hip fracture patients. Do you believe 95% of those occurred as a result of a fall? When an elderly patient comes into our facility looking for rehabilitation after a fall or for general balance issues, we tend to focus on 5 key areas. The first intervention we typically incorporate into this patient's plan of care is lower extremity neuroreeducation for the ankle, hip, and knee. We also focus on strengthening these areas so that a patient is able to produce the appropriate postural strategies in which we will look at later. Other areas that we focus on are core motor control for sitting balance and standing balance, and we also aim to reduce any joint pain that patients may be having. We also adjust correct posture and implement gait training techniques to improve balance. But before we can really dig in and start assessing which interventions are most appropriate for our patients with balance issues, we must first understand the key contributors to balance: proprioception, posture and postural reactions, strength, and the relationship between center of gravity and base of support all play key roles in maintaining balance. Proprioception is a very important aspect of balance as we rely heavily on visual input, vestibular input, and somatosensory input. If the patient cannot see clearly, they may often run into things or trip and fall. The vestibular system responds to gravity acting on our head, so if something is off, we may become dizzy and lose our balance. Our somatosensory system responds to stretch, tone, and even autonomic postural reactions, so if we notice any deficits in these areas of our patients, we also have to be concerned for an increased risk of falls. Postural reactions involve unconscious motor control and ensure correct spinal alignment and the use of ankle, hip, and stepping strategies to maintain balance. When we're looking at the relationship between center of gravity and base of support in our patients, we're assessing how high the center of gravity is and how wide the patient's base of support is. When we are advancing our patients' exercises, these are the components that we must challenge. And last but not least, strength is also a key contributor to balance. Without core strength and lower extremity strength, we would not be able to achieve dynamic movement. Understanding motor skills is essential to progressing any type of movement. The first skills that are developed are mobility skills or transitional skills. These skills are the ability of a joint to move through all available range of motion and allow a person to be able to move from one posture to another. This action changes the base of support over the center of mass. After this task is accomplished, the next developmental skill acquired is stability, needed for static balance. This is the ability to have co-contraction of agonist and antagonist muscles that help elicit and maintain postural stability with the center of mass over the base of support. Static balance is balance that is not in motion, and the base of support is fixed. After static balance is developed and maintained, dynamic balance will occur. This is the ability to maintain stability while performing an activity or the ability to have postural sustainment while all body parts are moving. In this stage, the base of support is also fixed. The last and final stage of motor skill development is the final skill. At this point or level, the patient has mastered the 3 skills prior to this one and can perform a task that is challenging to the basal ganglion of the brain. This patient should be able to perform coordinated movement sequences, and the center of mass is in motion while the base of support is also changing. If we use the development of a child as an example, we can go through and understand how the development of motor skills work. Think of a child who is learning how to roll over. They're developing the mobility skills. When a child learns to sit or stand, they are demonstrating static balance development. When a child learns to stand and or sit while reaching for objects without losing their balance, excuse me, they have mastered dynamic balance. And finally, the child is able to walk freely throughout the room and has developed the skill. Our clinical question asks whether core strengthening exercises or lower extremity exercises are more beneficial for balance. Well, let's take a look at how posture affects our balance. If you look at the picture on the left, you will see that the first person is demonstrating optimal alignment. You will see the line of gravity should pass through the axis of rotation of the head, neck, and trunk. This posture reinforces co-contraction of the agonist and antagonist responsible for core stability, as we talked about in motor skill development. As you look at the decline in postures in the examples following the first, you will see that the line of gravity takes on many different shapes. Now, the center of gravity is in various positions in relation to the base of support. This means that the patient's balance will be off. So how can we help these patients fix the path that gravity should pass through? We must help these patients maintain core co-contraction to establish core stability. For increased core stability, we must strengthen the multifidus, the diaphragm, the pelvic floor muscles, the rectus abdominis, the transverse abdominis, and the internal and external obliques. Addressing these specific muscle groups ensure that neither the agonist or antagonist is stronger than the other and potentially creating postural deformities. As mentioned earlier, as therapists, we often have an inclination to address balance by strengthening lower extremities. Lower extremity strength is important when looking at motor output generation. Our body takes different steps to try to reach a stable point when our balance is challenged. The first strategy that we implement is called the ankle strategy. This occurs in the anterior-posterior plane and is activated during a quiet stance or when small perturbations occur. These small ankle muscle contractions help us restore balance and maintain a stable position. Next, we will implement weight shift strategies. When we do this, our body shifts its weight laterally from one leg to another. We also utilize suspension strategies when we tend to lower our center of gravity by flexing our knees, which causes our hips and ankles to also flex slightly. If there's enough force and the ankle strategy techniques do not prevent us from falling, unconsciously we will employ the hip strategy. This is used during larger perturbations and during instances where the center of gravity pushes the limits of stability. The hip strategy mimics the suspension strategy. If somebody endures a great enough force that the ankle and hip strategies do not prevent a loss of balance from occurring, the stepping strategy will kick in and cause the person to either take a step forward or backwards to maintain stability. So, we can really see how having strong lower extremities are important to maintaining balance. So, if strengthening our lower extremities helps with balance, what does strengthening the core do? Having a strong core allows us to complete everyday tasks such as putting on shoes and completing functional activities like standing at the sink and brushing our hair. Core strength helps with on-the-job tasks like lifting, twisting, standing, and even sitting. Core strength can help maintain a healthy back and decreases the risk of low back pain. We also need core strength to participate in athletic activities and even sexual activities. Without core strength, we wouldn't have the needed power to complete household tasks such as vacuum, mop, and even garden. Most importantly, core strength assists with balance and stability and can even help reduce the risk of falls. It also helps ensure optimal posture, which can decrease wear and tear on the spine and can even encourage correct breathing mechanics. So what does all this really have to do with the elderly population? As we age, the body goes through a series of degenerative changes. We will begin to experience functional deficits such as decreased balance and functional activity participation. The body goes through neurological changes and nerve cells begin to die and also begin to function slower. This can cause a loss in reflexes and sensation. As we age, we will begin to notice increased muscle atrophy. This is because the body mass decreases largely due to muscle tension decreases. Fat deposits will begin to develop in muscle tissue, and muscle tissue begins to regenerate much more slowly. Tissue regeneration is often replaced with the tough fibrous tissue, which makes normal muscle contraction ineffective. The skeletal system also undergoes changes as bone mineral absorption begins to decrease. Bone mass also decreases. There are changes occurring in the joints as well. Joint fluids begin to disappear, articular cartilage and spinal discs begin to deteriorate, and osteoporosis forms. If we look at the picture on the right, we can see the changes that the body enters as we age. If you notice, that imaginary line of gravity that we saw earlier slowly begins to change, and the abdominal muscles are stretched as the lordotic curve in the lumbar spine increases. Due to natural changes, we really do shrink as we get older. Core strengthening interventions should be implemented into physical therapy treatment, but you don't have to take my word for it. Research concludes that core muscle strengthening improves balance performance in older adults. Please take a few minutes and pause the video and review the next few slides with the research literature that confirms this point. So how can we incorporate evidence-based research into our facility? We can start addressing core strength in addition to our traditional interventions. I have provided printouts of progressive core strengthening exercises that we can use in the facility with our patients, and I have also created a template on MedBridge that we can all access to give our patients as home exercise programs. After reviewing the core components of balance, it is imperative that we address core strength with our elderly patients. Core stability interventions can produce results for more than just increased knee, hip, and ankle strategies, as most traditional therapy interventions focus on. If we increase the use of core stability strengthening techniques, we can also help alleviate other age-related conditions and symptoms that occur as a natural part of aging. By incorporating core strengthening into our patients' interventions, we are treating the patient as a whole and not just their symptoms. Thank you for watching.